The rationale for this meeting was to try to get an idea of how applicable the St Gallen recommendations are in the Asia Pacific region. We know that St Gallen recommendations were based on an idealised situation, so there was an assumption that any treatment was available, any imaging modality was available. What would be the recommendations for treatment in that situation? The real world situation, of course, is quite different. Not every region has access to every drug or imaging modality or treatment modality, and so we wanted to get a picture from key opinion leaders in the region as to how applicable these recommendations were. There are several interesting findings from the consensus group. The first one was that we cannot assume that the effects of treatment, and in particular toxicities, are going to be the same in every region and every group. So for example, the starting dose for docetaxel treatment in Asian patients is usually less than it would be for Western or Caucasian men. Another point that came up was that there were differences in access to imaging technologies. So for example, in Indonesia, access to isotope bone scanning is extremely limited, so that cannot be used as routine evaluation of staging or response. Probably one of the most obvious disparities were in access to different types of treatment. The St Gallen recommendations obviously included any type of treatment regardless of cost, but not all of these drugs are available in every region. So where recommendations might be to use new or expensive therapies, these simply aren't available in all regions. A fourth point that came up related to differences in the multidisciplinary approach to treatment of prostate cancer. In Australia, for example, we have a very well-oiled machine where we have urology, radiation oncology, medical oncology, many other disciplines involved in our multidisciplinary teams. In many regions within Asia, the treatment of men with prostate cancer is driven primarily by the urologists, and often there's little, if any, involvement from the other disciplines. One interesting point of the discussion was, of course, that there's often an assumption that prostate cancer is the same in any man or any population, and that's clearly not true. We don't have a good understanding yet about differences in prostate cancer epidemiology, biology, genetics across the various regions within Asia Pacific. That might have very profound effects on the way the cancer behaves and how it responds to treatment. ANZUP is the Australian and New Zealand Urogenital and Prostate Cancer Trials Group. This is a broadly multidisciplinary cooperative cancer clinical trials group set up to cover all disciplines involved in the care and research of all types of genitourinary cancer. At the moment, we have over 1,400 members across Australia, New Zealand and internationally, and we're performing clinical trials in all types of genitourinary cancer.